Good morning, and welcome to this week's episode of Dr. Murphy's Public Health for You series. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
I'm doing quite well. Good morning.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID and infectious disease public health questions each week and will be going through the latest headlines through today, December 19th. Any questions or comments are welcome down below. Starting today with a massive safety and efficacy review of the big three respiratory illness vaccines. That's COVID, that's RSV, and it's flu. Can you break it down for us, Dr. Murphy?
Yeah, this is a great review article that summarizes the findings from 511 studies that were included in the review. And these are rated by quality and results. Quality of the study, quality of everything, and the final results. And they looked at the three of the four deadly causes of pneumonia. So COVID, RSV, respiratory syncytial virus, and flu. The fourth one would be pneumococcal pneumonia, the regular bacterial pneumonia. That is not included here. Okay. But these are three viruses that are deadly. 511, 511 studies with like thousands of patients. All right. And so what happened? So they looked at virologic efficacy and they looked at safety. All right. COVID-19, the mRNA vaccines that are out there, had virologic efficacy in adults and pediatrics between 46 and 50% in adults. And in children, it was even higher, 65%. And this included all sorts of types of patients, all right, all eligible to take the vaccine. For RSV, this is for adults over 60 now, showed a pooled virologic efficacy of 79%. It's even better. Against hospitalization with similar coverage, 70 to 73% for immunocompromised individuals. And then the other group that takes this are pregnant women that want to give they make the antibody and then they pass the antibody on to the baby and the mother both get benefit from this. And the treatment effect of the monoclonal antibody that's given to children in particular was 79 to 83%. So this is like for vaccines, this is like incredible. And then for influenza vaccine showed the pool efficacy of 48% for against hospitalization for adults. And don't forget, there's a lot of deaths involved too. And 42% for over 65 specifically, and 67% for children, again, having a higher rate. And so this is typical vaccine efficacy. Since it's a population-based thing, and we have 336 million plus people in the United States, this is an enormous impact on the health of the country. If you look at the safety, the COVID-19 vaccines in particular, which we worry about heart effects of the vaccines in particular, so myocarditis, that's an inflammation of the heart, was 1.3 to 3.1 per 100,000 doses. All right. Now, it was heavier in male adolescents. They seem to be the most susceptible to this. Myocarditis can be life-threatening, but it's typically not. It typically resolves on its own. The RSV vaccine was tied to 18.2 excess cases of Guillain-Barré syndrome per million people who take it. So Guillain-Barré can just happen, and there was an excess of 18.2 cases. That's just number of cases. So, with millions of people getting it, yes, there's side effects, but they are really, pretty low. There are a few deaths associated with these, but don't forget, you've got tens of thousands of people dying from these diseases every year. So there's always a trade-off. And especially if people are sick with other things, it's hard to kind of tweak it out. But there's no huge amount of excess death or really serious outcomes compared to the life-saving benefit that we see here. I mean, if we did not give these vaccines, um, you're talking maybe 100,000 people total. The estimates vary, but pick your poison. I'd take the vaccines.
Absolutely. And getting deeper into COVID here, there was a really interesting little study published and reviewed regarding sleep apnea and COVID infection. Could you break that down for us?
Yeah, sleep apnea is a terrible condition that people some people when they're particularly men when they're sleeping they kind of stop breathing for a while. That's what they call it apnea, which means not breathing, sleep apnea. And then they all of a sudden start breathing again. And what happens is it disrupts the whole sleep pattern. And they don't sleep well and they're irritable and they can fall asleep during the day. And I mean and it's treated with a variety of things, but most common is CPAP. You may have heard of CPAP, where people have to wear this mask at night and have this machine, and it's noisy, and the person they're sleeping with hates it, but the person that's using it usually sleep great. But it's a complicated condition. So what they found in this study reported by the Cleveland Clinic was that in 52 patients that they followed, and to do this is, this is intense follow-up with pulmonary measurements and whatever. They found that after um, having actual COVID, the rate of sleep apnea increased 17%. Okay, 1 out of 6 or so people, but I mean, 1/6 higher. This is, you know, that's a big chunk. And so, just knowing this, we can look at other diseases as well to see what's associated with sleep apnea. We already know some of the other factors, but it looks like COVID itself is one of them.
Yeah, that's big news. So something we will be following and looking for follow-up research on. But something, again, that we have been following for the entire year now is this year-long measles outbreak here in the US. Almost 2,000 cases now. Can you bring us up to speed?
It's not going away. This is a broken record. 46 new cases in the last week, bringing the total to 1,958. Of those, 222 were hospitalized, 3 have died. The same 3 that we've reported in the past. It includes 26% of cases have occurred in children. Okay. And it's the unvaccinated people that are suffering here. And with the vaccination rates going down, this is never going to go away. It's basically here to stay.
Hmm.
The only way to stop this is to get the vaccination rate back up to 95%. Remember in the year 2000, when we had 95% vaccine coverage, there were no cases of measles. None.
Hmm. And we're seeing spread in the same places that we were the last weeks. It's that Utah-Arizona border and
Yeah,
then out in South Carolina
it's going
again.
to float around the country and all the pools of people that have a lot of unvaccinated people. Yeah, Canada and Europe, but they're having the same problem. It's not just us, but it's all related to vaccine coverage. Measles is highly, highly contagious.
Mhm. Now, looking at routine surveillance, something that we need to keep surveilling is our food system. Recently, there was just a report of a 8-year-long listeria outbreak of 2 different outbreaks. Can you give us the details?
So listeria is a bacteria, and it can cause all sorts of problems, illness, hospitalization, and even death. And it can cause women to have miscarriages as well. So over the past 8 years, the total outbreaks caused 30 illnesses, 27 hospitalizations, and 4 deaths, all related to this kind of prepackaged salad stuff. And two different firms over 8 years. It's very difficult to pinpoint because that kind of produce moves around through so many different middlemen and stuff like that, that it's difficult to actually find the pinpoint the source. But it's just another one of those things that's out there. And I think the key here is, it can be life-threatening. And we need, it's very important to continue to look for these. If you don't look for these, you won't find them. People will just be dying kind of around, and it's not, the data has to be put together someplace. And this is what the CDC is supposed to be doing. And they, in the past, have done a very good job. And what they do is they help really coordinate all the states. We have 50 states and 6 territories with Americans living in them, and they coordinate all that. And it's a very centralized effort that's required to follow these things. And this is just an example of how important that can be, because this is potentially life-threatening, or at least ending up in the hospital.
Absolutely. And that is a great preview for future discussions that we will be having on this show. You may have seen in the news just recently that the CDC is looking to uh, not the most trusted sources for studies that they're pointing to as evidence. So, we just got to stay strong following these known things.
Yeah. I mean, this is what they're supposed to do, and we should let them do it. And otherwise, this is just going to all fly under the radar screen, and you could be impacted, and no one's going to know the difference.
Absolutely. Thank you so much, Dr. Murphy, for bringing all of this to the surface, explaining all the important details, and we'll see you after these holidays. Happy holidays, everyone.
Happy holiday.
Thank you.
We will not be broadcasting next week. We're taking the Christmas holiday off.
hmm So we'll see you either in the new year or right before it. Have a great one, everyone.